Hello, everyone. My name is Dr. Joel Rosen. I am the main practitioner, functional medicine, integrative medicine practice doctor here at Boca Raton Healthcare Center. I am producing this video for all my thyroid and fibromyalgia patients who have requested for more information from me. And basically what I wanted to do is I wanted to do a case study today. So if you're suffering with fibromyalgia pain, brain fog, joint discomfort, migraine headaches, tender spots all over the body, gastrointestinal issues, feeling cold all the time, can't lose weight, can't focus, have no energy, are not sleeping. Hopefully I'm hitting the nail on the head because I see you guys all the time. I wanted to go over a case review because I know that a lot of doctors that you go to, they prescribe you medications, they tell you that your blood work is normal, and you still want to know why you feel so crappy. And so typically what they'll do is they will give you medications like Lyrica, Cymbalta, gabapentin, a lot of different anti-inflammatory stuff to try to help with your pain. But meanwhile, they may even give you some antidepressants too. So what I wanted to do is I wanted to do a case review. So I wanted you to look over my shoulder, so to speak, on how I work with someone who's dealing with a fibromyalgia or a thyroid problem, because a lot of them are related. And in fact, most thyroid patients are fibromyalgia patients, and most fibromyalgia patients are thyroid patients. So we don't have them being mutually exclusive, but we want to definitely rule out both. So the first thing that I'll do is I'll look at your glucose levels, because typically when we have a fibromyalgia problem, the blood sugar does not stay stable, whether it's too high or too low. It needs to be stable throughout the entire day. And because the lab ranges are so broad, you're not going to be told if your blood ranges are not normal, if they're not sicker than the average sick person. And the ranges today are so broad that the healthy population is now diminishing, and you're typically not unhealthier than the average healthy person or the average unhealthy person. So you're told your blood tests are normal. The second thing are anemias. This is missed a lot based on the huge wide ranges as well. So B12 absorption, iron deficiencies, chronic illness. I see a lot of functional anemias, and because it's not past the lab ranges and it's not flagged, it's being missed. However, these patients continue to be tired, exhausted, no energy, are cold, all the in pain, all the things that you're dealing with. Inflammation. One thing is for sure is that if you're watching this video and you're dealing with fibromyalgia problems, you're inflamed. Whether it's homocysteine levels, uric acid, ferritin, even white blood cells, neutrophils, lymphocytes, eosinophils, monocytes, chances are you're being told nothing about these and how that's impacting your immune system. And it's safe to say if you're inflamed and you have all the things that I talked about, we need to get to the cause of your problem and eliminate those so that we can get you back to the road of recovery. The other thing is gut health. This is what I specifically wanted to tell you about. I can't tell you how many times I work with someone and they've told me that the doctor told them that they did a gluten test and they were non-reactive and they can go ahead and eat gluten. And so I had a patient here, I'm looking at her chart right now, and she told me that the exact same thing. She's dealing with fibromyalgia problems. The only antibody that they tested for was deaminated antibodies, IgA and IgG. In English, what that means is there's so many different types of structures that you could react to in wheat. There's 24 different kinds, and LabCorp or Quest only tests for one of the 24. So that's, imagine, like I say, the analogy is like me looking in the ocean and having blinders on and someone asking me, do you see any ships? And I say, no, there's no ships. And then I do this, and then I realize, oh my goodness, there are ships. So you're making false conclusions on limited views of your blood tests. The other thing is genetic testing. No doctor is doing genetic testing at all. We do a lot of genetic testing to see how mom had fibromyalgia, or mom had autoimmunities, or mom had depression or anxiety, and what the relationship is with you so that we can put approach together nutritionally. And the last thing is antibodies. If you're watching this video and you've been told that your thyroid is normal, or you're on Synthroid or Cytomel or levothyroxine or Armour, I'm guessing they've never tested your antibodies to your thyroid, or they've never tested them again. And so those are a lot of the clues that we use to help patients recover with your fibromyalgia symptoms or thyroid symptoms. So what I wanted to do is I am now doing $300 consults because I am very busy. I see a lot of patients across the country on Skype and in my office. But what I wanted to do for you guys is offer you a special one-time offer of $99. So that's a $200 saving. But I'm only going to do this up until the end of the month. So make sure you give my office a call, 561-883-0090, and tell David or Sydney you just watched the fibromyalgia or thyroid video and you're looking to take advantage of the fibromyalgia case review, which is normally $300, but it's going to be $99. So look forward to helping you in your recovery of your fibromyalgia nightmare, and we'll talk to you soon. Thank you so much.